Hello guys, Namaste. I am Gautam Prasad Chaudhary and today we'll be studying about another topic about peptic ulcer. So before we start our topic peptic ulcer, we need to develop some basic concept. So you are seeing on my screen about the different parts of stomach, like you can see here cardia, fundus, body, pyloric intrum, pylorus and duodenum. These all are the part of a stomach. So on the basis of locations, we can differentiate a type of ulcer. For example, if the ulcer is in this any part of a stomach, then it's called a gastric ulcer. For example, if ulcer is in cardiac part, or if it is in a fundus part, or sometimes it may be in body part, or sometimes it may be a pyloric antrum or pylorus. If it is in these areas, then we can tell as the person is having or patient is having a gastric ulcer. But apart from this body part, or apart from this stomach part, if it is in duodenum, in this part, in this area, you are seeing the cursor. If it is the ulcer in this area, then it is called as a duodenal ulcer. But sometimes, apart from this duodenum part or stomach part, sometimes the lesion or ulcer may be in esophagus protrusions, and that time we call as a esophageal ulcer. So basically, we can classify ulcer into three types. One is a gastric ulcer. If it is in fundus part, cardiac part, body part, or any part of the pylorus, or duodenal ulcer if it is in a duodenum part, and esophageal ulcer if it is in a esophagus. So this is the basic information about the ulcer. So we will see the lining of a stomach. In this stomach, we have a different type of lining or different layers of a stomach. You can see here mainly there are four linings are there. There are mucosa, submucosa, muscularis externa, serosa. So these are most important linings of or layers of a stomach. Number one is a mucosa, and submucosa is the second lining. Muscularis externa is a third layer, and serosa is a outer layer. So most inner layer is a mucosa. So again, this mucosa we can classify into three types or differentiate into three layers. We can say as a surface epithelium. This is a first lining that comes under the mucosa, and after that there is a lamina propria and muscularis mucosae. So these are some important linings that comes under the mucosa. So totally we can say there are 7 layers of a stomach. That's mucosae, submucosae, muscularis externa, serosa, and surface epithelium, lamina propria, and muscularis mucosae. So these are the important layers of a stomach. And you can see here, this is called a gastric pit. Okay, in stomach, inside the stomach, you can see this elevation and depression part. That is, this is a mucosa. So I am trying to make it our zoom. You can see it like this. So in this gastric pit, you can see a different types of cells. The most important cells are parietal cells. You can see here, and below parietal cells there is a chip cell, and below chip cell there is a enteroendocrine cell, also known as a enterochromaffin cell or ECF cell. So these are some important cells present inside this gastric pits. So we will see importance of these cells in next slide. So this was about layers of stomach, and I think you are clear with this slide. So we will try to see another slide. Let's see the function of stomach.